Good afternoon, everyone. Dr. Tamani, board certified dermatologist discussing hair loss. And today I'm joined by Dr. Zach, who is also a board certified physician that specializes in hair loss and hair restoration. We felt compelled to bring this information to you as a patient of hair loss regarding a test called trichoscopy of the hair. Look, anyone doing your exam without trichoscopy is cutting you short. And Dr. Zach will help explain what is trichoscopy, what is that device called dermatoscope, how it can help diagnose your hair loss, and what applications it has. Zach, thank you so much for joining me at the end of a long day in the Skin of Color conference. Could you tell me a little bit more about what is that device called dermatoscope that you use in trichoscopy?
Yeah, a dermatoscope is a handheld device, allows me to look at the structure up close and personal. It magnifies things.
So how does it work essentially?
So it emits light and it magnifies the structure through lenses. I like the one, I think it's the German technology. It's called Heine.
Yeah, it's been very reliable. So, we get close to it like we do on a microscope and then kind of like push it down on the scalp. And is it like a biopsy, somebody might wonder, or a patient might wonder?
No, it's not like a biopsy. It's not invasive. Biopsy is invasive. You need to use sutures, anesthesia, and cut into the skin. This is very simple. You're just looking through a lens and adjusting your magnification to see the structure you're looking at.
It's amazing. So it's non-invasive, and patients need to know that they do have an option besides a biopsy. So when you're looking at the hairs, what are you looking for essentially?
So I'm looking, about the distance between each individual hairs. I'm looking to count a hair in each centimeter square. I'm looking to see if there is any discoloration around the hair follicles.
So you count hairs, and are you able to, as you implied, to see the quality of the skin be between hair follicles? What do you look for when you're looking at the skin itself?
Yes, I'm looking to see if there is any discoloration around the hair follicles, redness, white discoloration. I'm looking to see scales. I'm looking to see if there is miniaturization, which is thinning of the hair.
So are you able also to see if there's hair follicles regrowing, any that can be regrown?
Oh yes, I use this a lot because that will allow me to see whether my treatment is working or not. I look at the hair before the treatment, and then I look at the hair after the treatment. That will give me a great idea about the treatment, whether it's working or not.
Would you consider it also as a device that helps you decide whether a patient is a candidate for a certain treatment as well?
Absolutely. There are so many patients that are not candidate for treatments, and there are some are candidate for treatments. So yes, it allows me to be able to proceed with specific treatment versus another.
That's amazing. So to recap, you can put pieces of the puzzle together and come up with a diagnosis. So let's recap a little bit about the hairs. You can count them. You can check the distance between them. You can see if there's ones that are salvageable, if any are coming through. And then I would go back to the point of mentioning color changes and texture changes. Could you be a little bit more specific? For example, when you see, let's say, like a pink color around the follicles and scaling, what would that mean? If you see a white color, what would that mean? If you see a brown color, for example, what would that mean?
Yes, I mean, this all have to do with scarring versus non-scarring. The a change in color allows me to search for certain diagnosis, okay, versus normal color. In normal color, which we see mostly in non-scarring alopecia, such as androgenic alopecia, we can proceed with the treatment immediately. Whether it is discolored, I'm going to go ahead and look for scarring alopecia and maybe get a biopsy then.
That's amazing. So it's your prompt and your trigger to get more testing done. Well, I think it's awesome. Personally, the way we use it makes me think that any patient that doesn't get trichoscopy performed by their clinician is, not being, they're being cut short. And I think it's a valuable tool.
All right.
Thank you so much for your time, Zach. I really appreciate it.
Thank you.